Parliament, that's one of the areas where we do find strong unanimity. There is right now support for a mental health program. Part of the mental health priority came through some of the things from a previous speech we thrown a couple of years ago. It's not, in my view, adequately funded, but there's definitely a lot of awareness. There's awareness of the need for suicide prevention strategies. There's awareness of anti-bullying. A lot of these themes keep coming up. The mental health issues and the overlap with criminal justice, I think, went backwards with changes to the criminal code that were included in some of the spring legislation, where the not criminally responsible tag is now, they've changed not criminally responsible in such a way that you can be locked up for longer, and the concern from some of the people who testified before the Justice Committee was that lawyers could encourage someone who is normally not criminally responsible and therefore going to go into a sort of a medical treatment stream, because this law has been changed to basically say fairly arbitrarily you could be kept for much longer in custody, that for a small offense, someone who is not criminally responsible and needed medical treatment might opt to go to criminal justice for a shorter sentence. So you get the problem of unintended consequences, and they basically, one of the traits of the way Stephen Harper legislates is to take a horrific example, something that's gotten a lot of news headlines, and legislate around that. So even though the horrible attack on the Greyhound bus, where the poor young man was beheaded, the man who committed that offense was not within the not criminally responsible stream. Wasn't someone who this law would apply. But they use examples like that. So the mental health professionals who testified before Parliament urged us not to accept these amendments for fear that we would increasingly demonize and marginalize people with mental health issues by making it look as though they were more likely to commit acts of criminal violence, even though on statistics it's not true. So that was a step backwards. It was one of those bills that I regretted to see passed. Well, I think everybody, I think a lot of us are aware of that, whether our children have mental health issues or not. I mean, the killing of the young man in Toronto on the streetcar appeared to be a situation that completely should have been diffused, and he wasn't a danger to anyone by the time he was off by himself on the streetcar with a knife. They have brought criminal charges against the police officer who shot him and killed him. But for mental health, the needs for mental health, the needs for treatment are inadequately met in our society. We need to be able to ensure that people can get the help when they need it, that families get the help when they need it, and that someone who's identified as being at risk to themselves or to others gets the treatment and help they need. And that's part of the mental health national strategy. As I mentioned, there's some good intentions there, but it's not currently sufficiently well funded. And certainly when I talk to RCMP officers and to policemen, they're dealing with it as frontline responders, knowing that they're dealing with medical conditions for which they're not properly or fully trained. It's not their area, but for the absence of sufficient, and a lot of this is provincial in terms of provision of health services, but as downloading occurred and money was cut some time ago, I mean, go back to the mid-90s for how much money was cut from healthcare in Canada, we have this gap where people need services, the services aren't there, and for the lack of mental health treatment facilities, families go through huge strain, and society as a whole suffers. So it is definitely a priority for many of us to see programs back in